Hello everyone. So this is my first live. I'm going to be speaking to Dr. Suraj Vatish about everything tongue tie. So I need to now try and add him. So I've got to work this out. There we go. Press this button. Let me see. Let me see. Right, let's see when he comes on. Should come on any minute. Okay. Oh, what's this? I don't know. Okay, any minute, guys. So Suraj is actually someone that I found after looking for about 3 years for someone that's really, really good, specialist tongue tie, adult tongue tie in the UK. Hold on. Someone else is trying to join. I don't know who it is. Hold on. Hold on. Guys, just getting my head around this. Oh no, it says he's unable to join. Let me try again. Invite again. This is what makes me nervous about using technology. Right. Try. Oh, he joined. Yay!
Hi Hayley, how are you?
Hey, yeah, good, thanks. How are you?
Good, good. Enjoying your Sunday?
Yeah, very much. Yeah. How about you?
I'm good, I'm good. Can you hear me okay or
Yeah, all good.
all good? Perfect.
Yeah, thanks for coming on. Yeah, I was just briefly saying then that it's taken me years to find to find you basically because I was doing myofunctional therapy in 2019 and there wasn't actually anyone in the UK that had trained with Dr. Zaggy at that point because he's like the
Yeah,
leading American guy that's done all the posterior tongue tie. So what's it called? Yeah, the posterior. No, it's
yeah,
functional tongue tie release, isn't it?
yeah, the functional frenuloplasty, yes.
Yeah, sure. So yeah, I couldn't find anyone at the time, and I was doing my functional therapy. That's when I discovered I had a tongue tie.
Oh
Um,
wow.
so for 3 years, I was looking, and I don't know when you qualified, but then I stumbled across you, and you've been doing it with children for years, and then you train with the adult tongue tie release.
So yes, I actually started doing tongue tie releases almost immediately after university. And the story is really funny because when I was doing my oral surgery training, I did a tongue tie release with
Right.
scissors and it bled like no one's business. And I said, at that point, I'll never do it again unless I've got a laser. So when I started to move back to the UK, I started to work in American Smile and Happy Kids, and I was exclusively practicing or doing all the implants and adult treatments. And then we got told of a laser. And then I said, okay, well, I've done the basic training in tongue ties. I said, oh, something I want to look into. I've always kind of been at the back of my mind there.
Mm.
And once I went down that rabbit hole, there was no coming back.
Really, yeah.
And it really revolutionized how I work as a dentist, how I've changed as a person. I feel that, for years, the whole health profession has been very blinded.
Mm.
We kind of take a very symptomatic approach. So if a patient comes to see, let's say, your doctor, the first thing they do is they just give you the medication to kind of fix the issue.
Mm.
And once I've started to go into, let's say, the function of the body, I now see my patients from a very holistic point of view, meaning I'm always looking at, okay, how can I help their sleep, their
Yeah.
breathing, their eating, levels of anxiety and stress as well, which is something I've always been so passionate about, and also just their general well-being.
Yeah. Oh, totally. I think it all comes into it. And I think that, like, with the breathing and the sleep is huge, isn't it, for overall health?
Yes. So so a patient recommended me to read a book on biohacking, and that's when I first started to see the importance of sleep because it's something that everyone kind of takes for granted. It's like, okay, I'm going to go to bed at this point and I'm going to wake up, and the common misconception is that if you snore, you're in very deep sleep, and that's what I grew up hearing and listening to
Yeah.
my father snoring, and even myself as a child, I was a mouth breather, and no one ever knew why. And
Mm.
so I always used to feel as a child I wasn't very rested. I used to have dark circles under my eyes. I even had very forward posture. It was very, I had to really force myself to stand back. And no one knew the reason.
Mm.
I had orthodontic treatment as well. I had 4 teeth removed, and I never knew the reason why I was always so difficult for me to stand up straight.
Yeah.
And then as I started to learn more, I started to find out, well, actually, this is because I was mouth breathing. Now, my reason is because I had a lot of allergies that weren't diagnosed, but had I had the right care at the right time, you know, my mother did ask the GPs, they said, well, he always sleeps with his mouth open. I said, oh, that's fine. He's growing well. He's adapting. And yeah, that's where I feel the right help at the right time would have been beneficial. But
Yeah.
it's sleep is vital for children.
Yeah.
Everyone.
Yeah. Don't they say that like 90% of ADHD is just sleep apnea or
I
something?
believe so as well.
Yeah.
Like the amount of these days, we've got to understand that children have a lot of stimuli anyway.
Yeah.
Phones, there's everything's a lot faster and easier for them. But also allergens are an all-time
Mm.
high. If you live in central London, like I've grown up with, you do have a lot of pollution, you have a lot of allergens, and parents are unaware of the effects of that and even diet on their child's well-being.
Yeah.
And so when we look at that and you're looking at it from a sleep physiology point of view, a lot of children these days are sleeping with their mouth open, they're snoring, and they're grinding their teeth,
Yeah. A massive one.
which is where I start. The first symptom for me I get is parents like, my child is uncontrollably grinding their teeth when they're sleeping. And a lot of dentists just put it down to, oh, well, the child's stressed, they're overstimulated. But if we're looking at a percentage wise, it's a very, very small portion. If you see their tonsils are enlarged
Mm.
and they're having slight focusing issues, alarm bells should be ringing in a lot of people's minds to think, okay, what's going on here?
Yeah. So what would you say is going on? Is it always tongue tie related at that point, or?
So we do know for a fact that when there's grinding and enlarged tonsils, there is a mouth breathing issue.
Yeah.
Now, it usually is either a tongue tie or a nasal obstruction.
Mm.
So nasal obstructions can be a deviation, polyps, and even, like I say, very severe allergies. And so that's where we're aware that, okay, because of whatever reasons, the mouth, oxygen is favored to going through the mouth. This then in itself actually leads to a more fight or flight like response in the body.
Yeah.
So when oxygen goes through the mouth, the body thinks we're escaping from a threat.
Mm.
And then we release a hormone called adrenaline. Now, adrenaline causes our heart rate to spike, causes a lot of other like basically trains the body to run away from a threat. Now, when you're sleeping and you're breathing through your mouth, amounts of adrenaline are being released.
Mm.
However, they're in very low amounts. So that's when you might see children wake up and they're just kind of on edge. You have two scopes of people. Either you'll see someone who's extremely anxious, extremely agitated, running around everywhere, parents are unable to control them, or you'll see the opposite. They're completely lethargic, have difficulty even, conversing with you, and we see slow development.
Mm. Right. Yeah. Yeah. I know. It's actually huge. I've watched something the other day that said you shouldn't actually hear your child breathe at all at night. You shouldn't hear
You
them
are
breathe. Yeah.
you are 100% right.
Yeah. Yeah. Yeah, that's mad. And also when they pause, that's sleep apnea, isn't it? When they pause, almost just stop breathing for a moment and then breathe again.
Exactly. So breathing should be near enough silent but continuous. You should hear constant inhalations and
Yeah.
exhalations. However, any pause there, that's a sign of obstruction of
Mm.
air.
Mm.
So to understand, our airway is basically a big pipe that starts from the nose, has another part that joins it from the throat, and it goes all the way down to the lungs.
Mm-hmm.
Now, when there's any obstructions in there, so for example, we think about large tonsils and adenoids, it will make a noise,
Mm-hmm.
like and you'll start to hear snoring at that point.
Yeah.
So that's why the physiological reasons we have it. But then we've got to look at, why is the pipe obstructed? What's going on here? Why is this child not getting the adequate amount of sleep?
Yeah, sure. Yeah, well, and also, isn't the rate of like tongue tie like 50% or something? Isn't it gone up? Ridiculous.
Yeah, so in literature, I believe they say it's about 30%.
Right.
In practice, and when I was lecturing a couple of months back, I had a room of about 70 students. half
Yeah.
of them were tongue-tied, and that's what I predicted. I
Yeah.
said half of you are probably tongue-tied, and when we did the assessment, and I did the assessment on them, we actually realized that most of the students fell into that bracket.
Whoa. That's crazy, isn't it?
Yeah.
And do you think it's because obviously that mewing thing where the tongue should be to the roof of the mouth and that's not happened, maybe everything's got tighter, or do you actually think it's almost like a genetic defect type thing that's being passed on? What would you say
I
about
believe
that?
it's genetics is one
Yeah.
factor, is probably one of the main factor.
Yeah.
Diet also is another factor as well. So when studies are looking at, for example, trying to find out the cause of tongue tie, because it's something that really happens in utero, it's really difficult to kind of quantify. So we're seeing that kind of B vitamins are one reason of doing it, and the other reason obviously genetics.
Yeah.
When it comes down to the mewing techniques, mewing is perfect because it kind of tells us, shows us the results of having that poor tongue posture and mouth breathing, where we see poorly developed upper faces, and we have to try and correct everything from that point. But the philosophy is completely correct of mewing. But the cause of tongue tie, I believe, is diet as well.
Mm.
Nowadays, our diet is highly processed. Unfortunately, has a lot of different additives, preservatives, and that we don't know how that plays into our metabolism.
Mm. So do you mean diet is in like deficiencies, like the folate one with the
So,
MTR?
yeah, folate as well
Yeah.
plays a factor, and then also taking vitamin taking B supplements also can lead to tongue tie as well.
Oh, right. What, you mean the folic acid instead of the folate? Is that what you?
Yes. So
Yeah.
folic acid. So when you take folic acid, you take it to avoid spina
Yeah.
bifida. So in complete fusion of the spine. But however, one of the side effects we are finding is a tongue tie in babies.
That's crazy. Because that's what all the prenatals are, and that's what I've never taken prenatal or advised it because of that folic acid. It's literally just so toxic, and people aren't taking the right form. So I did know that the correlation between tongue tie, but I think you've got to have that mutation, that MTA. Oh, let's say it wrong. I wrote it
The
MT.
MTA.
Yeah,
Yeah.
MT. Oh yeah, I said it backwards. So that probably coincides with that, taking the wrong B vitamins as well, doesn't it?
Yes, I definitely agree because I believe it's like a multifactorial cause. You can't usually pinpoint it to one thing. And
Yeah.
with genetics, we know it's like poker.
Yeah.
You have to have the kind of right combination of genes to get a trait. And I usually see it in my experience passed down from the father side. So
Right.
usually if your father's tongue-tied, then you're most likely to be tongue-tied. However, it does vary from like sometimes even the mothers or both parents are tongue-tied and they've not been aware about it.
Yeah.
Now, someone just commented about more bottle feeding and breastfeeding. I believe like obviously when bottles were made mass produced, like for example after the Second World War, it masked a lot of tongue-tied babies being born.
What was that? Say that bit again. What
So
happened?
after the Second
Yeah.
World War, bottle feeding became mass produced.
Right. Okay.
So there was a high infant mortality rate at the past, and it wasn't really documented why. And how I believe it is by looking obviously at the evidence and trying to deduce it, is that there were instances of tongue ties, but they weren't being diagnosed correctly or treated
Mm.
correctly. And then when you give a baby a bottle, you make it very easy for them to start feeding.
Yeah.
So you're just masking the signs of a tongue tie rather than and allowing that child to kind of get older.
Yeah.
So I don't believe obviously bottle feeding causes it, but you can see that obviously it masks the symptoms and kind of lets those children go under the radar.
Yeah. Well, that's what happened to me, I think, because I didn't even know until 5 years ago or something I had a tongue tie.
Yeah.
But my little boy it was hard to breastfeed him. Like for the
Hmm.
first 2 weeks, agony. And they said he had a slight tongue tie, but because he didn't have the vitamin K shot, they wouldn't do it.
Yeah.
So I wish I'd gone private at that point. But I thought, well, he's okay now. He's latched okay. But obviously it's created further problems down the line.
Yeah. So you'll always see everyone has a slight ability to compensate with it.
Mm.
So the way I always discuss it is like, for example, imagine someone with one leg. It's a bit dramatic, but someone with one leg running a marathon. Now, not everyone with one leg will be able to run a marathon, but if you've got that determination, that grit, or you've got that slightly better genetic makeup, some children do compensate well.
Mm.
However, these compensations mean the body is working extremely hard. And at some point, like you've seen in your case as an adult, or at some point, they always come back to try and you always see issues. So they always come back home. So you'll see issues with sleep, tight back and neck tension, grinding their teeth as well in adults. When I realized that this could be the cause of a lot of the bruxism patients we had, it blew my mind, because in dental school, we were told nothing about it. We were told bruxism happens because of stress. Put a mouth guard in your patient. And I was thinking, but how is that going to work on what the actual causing is? We're just kind of stopping the progression of it, but we're not really taking into the root cause.
Yeah. And that question there, like, what would you say the biggest health implications for everyone down the line?
Well, it depends on, for example, how the person's compensating. Generally speaking, we do have a lot of background health problems, such as sleep apnea creeping up, sleep disordered breathing. This paired on to it also with the amount of adrenaline in the body gets people very anxious. Now, we already know that if you snore, you're more likely to be at risk of high blood pressure, diabetes, and cholesterol levels.
Right, yeah, wow.
So it can have a very detrimental effect later on. And sleep apnea, obviously, just so you understand, is where oxygen stops, your body starves from oxygen for a few seconds. Okay. Now, to give you an idea, in an adult, once the brain is starved from oxygen, we start to see necrosis in the brain. So if anyone is in a life-threatening situation, the first thing they do is try and get blood flowing to get the oxygen back to the brain. Otherwise, parts of the brain die, and you can even have, obviously, like kind of a stroke issues after that. Now, when you've got sleep apnea, you have a lot of these small little events occurring, and the body's having to fight for that oxygen while you're sleeping. And that's why all of a sudden you wake up. So with sleep apnea, all of a sudden somebody's sleeping, they go, and then they'll wake up in a shock, because the body has to shock them awake to kind of get the oxygen back and to get them breathing well. Wow. And this itself, if you imagine on your emotional and emotional and mental well-being, is not going to be easy.
Yeah, because you're in fight or flight the whole time, basically. So your nervous system just, and that obviously with your nervous system being in fight or flight, it's adrenal fatigue. You're just on high alert the whole time, aren't you? Which is
exactly.
Yeah. Well, that
And also,
because I was going to say, because my sleep's never been great, because I've been going fight or flight.
Yeah, exactly. And I was just about to say to you, also imagine pairing that with the tightness in the muscles, the tightness in the fascia as well. So it's kind of like a big cocktail that goes in one area. Now, people kind of soldier through it, and I really do have so much admiration for them, because I tell them, even adults and kids as well, I'll say, you have multiple admiration. I said, you're basically living life as normal, but it's obviously so much harder for you.
Yeah, that's the thing, isn't it? But I think, what I noticed with my little boy is, so his teeth were all really spaced out when they were his baby teeth. And I was like, I'm kind of doing well. I breastfed him for 2 years. He never had a dummy. But then as soon as his proper teeth start coming through, they're already like almost crossing over, and his palate's already become more narrow. And he's got like a really gummy smile already, because what happens is your skull and your jaw grows down instead of out.
Yes, exactly.
Yeah, so I was like, oh wow, he's just turned 7. It's kind of good to get this kind of sorted, so he starts molding outwards instead of downwards.
100%. So I always believe early intervention is best. For me, that's why I love treating babies, because we have maximum efficiency at the best time possible. Now, when we have children, any time before they complete growth is a good time. Obviously, the earlier the better, because then we can work with their growth and make sure that there's no kind of relapses as well at that point. But with adults, unfortunately, once you lose the growth, it becomes more like kind of damage control in some ways. But with children, it's more, you can get nice wide palates, you can get the function back, and you can get them sleeping a lot better very, very quickly as compared to adults.
Yeah, that's good. Well, I did see one girl in America that had the tongue tie release, and then her upper palate had actually just widened naturally, just from the fact that she could get her tongue up constantly. So, and there's, I don't know if you've seen that Mewing.world, that Instagram, they do loads of like face pulling. And you can still mold the face, and people are doing miraculous things with widening. But it's a dedication, like 10 minutes a day of doing all this stuff to the jaw.
Yes, exactly. So I know Dr. B as well. So
Okay.
he's a good colleague of mine, and we were having a discussion about this because when we do mewing, for example, in adults, it's like I said, it's very, very difficult to get skeletal growth in an adult, but some people may not have the sutures or the lines closed between their palate. So they may be the very lucky ones that they can, with mewing or getting the tongue up there, you can actually expand it. However, for the majority of people at about 18 or 19 years old, that line between the palate solidifies and ossifies.
Right.
So if we were to expand it, you do generally need some extra appliances, or you need some surgery to kind of break that little part of bone and expand the jaws out as they should be. But still, I'm always minimally invasive. I tell everyone, try it. If you get any benefits, there's no harm done. It's only doing
Yeah.
exercises. So obviously, don't get your hopes up too much, but it's still very, very good for you to get the tongue up where it should be. Practice, practice, practice. And then if you get some results, fine. If not, we've got other options to help you.
Yeah, okay. Yeah, because that's one of the exercises. You get your thumb and you rub it on that line to get your brain to know that something's going to happen there. And then you start obviously trying to like work it out as if you're molding kind of clay.
Yeah.
But yeah, I think you've got to be really committed to that.
I wish, sometimes with bones, they can be so malleable at times.
Yeah.
And when I'm working, for example, doing my implant patients, I can see how malleable and how good bone can be. And then other times it is just like dealing with a big chunk of rock, and it just does not want to do what you want it to do.
Yeah. Well, I guess that's where nutrition comes in as well. Because if you're like calcified, not all got your fat soluble vitamins and all your other minerals and your boron and stuff, then you are just going to be some rock that's stiff, and your bones aren't going to be healthy.
Yes, exactly.
So, right. Yeah. So I was going to say, so how did you go from the child releases? You started doing laser with them, or you always went laser with the child one?
So my first release actually was on adults. I started doing children only when I got the laser in, and then I kind of never started doing start off with children. I used to see both types of patients always.
Okay.
So the anatomy is more or less the same, but the procedure is very different. So, for example, when we look at an adult tongue tie, you do need to. The good thing is you've got a lot more visibility because the adult can do what you're saying. They can lift up their tongue a lot more, but you need to do pre-op therapy. So myofunctional therapy, like you've done, because we need to strengthen the tongue because it's had a lot longer being in compensations. And then at that point, then when we do the release, we need to suture as well.
What's that?
Because put stitches in.
Oh, right, okay, yeah.
So with adult tongue ties, one of the best things I always say is putting stitches in, because it predictably allows the area to heal as it should.
Okay.
And also it makes when you start doing the exercises a few days afterwards, you'll see a bigger difference rather than if we leave it open. Even though we use a laser, we can. It's always better to join everything up, so then we're minimizing the amount the body actually has to heal.
Okay, I see. So you only do that with the adults?
Yeah, so adults and anyone really over the age of 4 get stitches every time we do a release. Babies, it's very, very difficult to stitch them because we're not putting them to sleep. So with that, the parents are manually stretching the wound from day one.
Okay. So with the stitches, does it not make it tighter, but then you've got to keep doing the exercises to, release it a little bit underneath?
We get very, very slight tightness. When I'm talking about, so when you do the release, you see the tongue really moving where it should be. We're talking about less than 0.5 millimeter, we get a bit of restriction. We then, at this point, reduce the amount of scar tissue forming. Right. So just to give you an idea, when we have any wound, the body, say these are 2 edges of the wound, produces scar tissue to start to join these 2 edges up. Now, the problem with scar tissue is it's very unpredictable. Some people may be lucky, they get it very elastic. Some people may be very unlucky, it gets very inelastic. Now, what happens when we suture is we're completely minimizing the amount of scar tissue forming. So then, and contraction, a bit of contraction is there, and then post-operatively, as it's healing, you get a bit more contraction because that's how the body's trying to heal. But when you start stretching a wound which has been sutured, it becomes a lot more malleable and moldable than a wound which is completely filled up with scar tissue. So predictability completely changes in that procedure.
Okay. Yeah, because some people might get like, yeah, keloid scarring or something if you're prone to that,
Exactly.
which also can be, vitamin zinc deficiencies and vitamin E and stuff. So, but is that a new thing then that Dr. Zaghi, is he saying to stitch after them?
So Dr. Zaghi's always believed in
Has
suturing.
he?
So Dr. Zaghi always used to do his releases with scissors. Now,
Right.
if you do a tongue tie release with scissors, you need to
Oh,
suture regardless because otherwise there's the hemorrhage there. So when he switched over to laser, he did a few studies, and we were discussing about obviously when not to suture and suture, but he believes, like I believe as well, that suturing actually in the adults and older children is probably one of the best things we can do.
yeah.
And when I did a few releases before I did Dr. Zaghi's official training as well.
Mm.
When I used to see the differences of wounds I didn't suture and suture, the healing on the sutured wounds was a lot faster, cleaner, less risk of scar tissue forming. And then the ones that I kind of just left open, we had a lot more scarring, and those actually were the ones that we had to repeat again in the future as well.
Oh, wow. Yeah, so what is the success rate? Obviously, you've got to do myofunctional therapy, so
Yeah,
people are asking about it. So obviously, you need a good, like 3 months probably, depending on the person, of myofunctional therapy to
exactly.
strengthen which is, I've got to say, which is probably the worst part of it. Like, it's so deep.
Yeah.
Um, so I'm trying to do that with my son again, and
Okay.
it's hard work. I have to like, reward him with Pokemon cards and just. It's not really working that well. And then obviously you get the release, and you have to do the myofunctional therapy exercises after, which is
Yeah.
absolutely key, isn't it? You cannot do any of the releases without that myofunctional therapy, because it could just seal back down, and your tongue's like a big strong muscle that could just then flap around as well. And
Exactly.
yeah.
So the I understand completely because the pre-op therapy, you're working through how the body's kind of grown up to be. So within 7 years, his nervous system is thinking, okay, this tongue should not be moving. And
Mm.
when we start working on those nerve connections, the body gets very overwhelmed. And it's uncomfortable. It's like going to the gym. It's like strengthening any muscle. It's uncomfortable. You need to train, you need to go, and you need to put the motivation in. And I do understand 3 months is a long time.
Mm.
I do like my functional therapy exercises myself as well because I want to know what I'm getting my patients to do.
Okay.
And I do understand it's a tricky journey,
Yeah.
but the best results we see is post-operatively. Now, a lot of practitioners don't believe in myofunctional therapy,
They're
and I
not.
tell them in the UK, a lot of people don't believe that actually it makes any difference. And when you see their releases after 7 days and you see the release of a patient who's had myofunctional therapy in the correct like functional
Mm.
protocol, they're two different scenes. The patient who has myofunctional therapy will heal a lot faster.
Mm.
Tongue mobility will be a lot better. They'll know how to understand how to use their tongue, like you said, so this doesn't create a shock for the body.
Yeah.
And also their fascia, so the layer that surrounds their muscles and everything else, is a lot more loose
Mm.
and ready. So
Mm.
when we actually do a tongue tie release on an older child or an adult, all of a sudden you start to see them walk up, like so their shoulders roll back,
Yeah.
and every single patient I see tells me the same thing. It's like my jaws just dropped, and my neck is feeling a lot looser, and my shoulders feel just
Yeah.
a lot better. So the myofunctional therapy also prepares the fascia for this release,
Mm-hmm.
and we find afterwards that when they do that, then they get a lot more postural effects as well. So then the posture becomes a lot better within the next. Well, once they stand up after the procedure, they're already standing up taller, and they come back to me and they're saying, "Well, look, my posture's become so much better. I'm not feeling like I need to round my shoulders a lot."
Wow. Well, that's the thing that like my trapezius, oh my God, so tight. I've just heard so many people say as soon as they get that like snip, their shoulders just drop. And I'm like,
Yes.
that's what I'm living for this release, because I can't even do kind of upper body exercises without it just feeling like it's burning
Yeah.
all down the neck and my traps. So yeah, I think that's one of the main benefits that I'm hoping
Yeah.
for.
Yes, and also we recommend that you see a body worker, so like an osteopath or a chiropractor, before the release as well, because for example, we're working on fascia. So fascia is actually it's a living kind of organism within your body. So it connects everything together. Now, when it's very tight because of the restriction in the tongue, it gets tight around all those kind of other areas. Now,
Mm.
when we start working with it like a body worker, they start stretching it out and they kind of get it to relax a bit. But the ultimate, but you will go back into the old habits probably within the next couple of weeks anyway, because that's where the body feels more comfortable. But when we release it and we get the tongue moving, that's when all of a sudden the body's like, okay, wait, I was in the wrong position all this
Right.
time. And then that's when, if you're constantly moving it and you're training it, you will see your breathing improve.
Mm-hmm.
Right afterwards, you might even feel your diaphragm drop when we do the surgery as well. So a lot of patients are like, well, my diaphragm is just a lot of air, a lot more air going into my
Oh,
lungs.
wow.
And we had another patient who just said, I feel like all the stress in my life is gone. I can't,
This is definitely a big sales pitch.
I can't promise that though. But these are just words of patients who have come and had the procedure with us, because it's strange how we have so many different reactions each time, but they all kind of come back to the same thing. Because in the end, when we're anxious or when we're not sleeping well, our fascia is also responding to that.
Mm.
And when we release the fascia and we're releasing that, then what we imagine is all these emotions also come out as well.
Yeah, I know. I've been really learning more about the fascia, and I've been trying to like do more stuff around face and neck with fascia, just kind of prepping myself. But yeah, fascia's huge, isn't it now? With
It is.
in the health.
It it's another area that we always overlooked, because it's something that it connects the whole body together.
Yeah.
And I work with quite a few osteopaths, and they're always saying that, you know what, one of the biggest lies we were not told was that the body actually develops from the mouth downwards.
Mm.
And there's Lucy, the osteopath who I work very close with. She is very keen on spreading that message around.
Well, yeah, because I've seen that where the tongue is literally like the first part of the fascia. It goes right down to the toes, doesn't it? If it's
Exactly.
pulled up here, then everything's kind of hunched up. And then if you release and get that tongue up, then everything self-corrects, hopefully. But obviously, like you said, you have to do the exercises and stuff.
Exactly. So immediately following the release, everything does kind of self-correct. But then, because the body's used to being in a very kind of tense state, that's when we have to start doing the exercises, the body work, the kind of putting the other ingredients into the mixture, because that's where we want to keep this new relationship that we just built up, and make sure that, we don't go back into any old habits.
Yeah, totally makes sense. There's someone that actually messaged me with a few
Yeah.
questions. So obviously, she asked what prep do you need to do, so we covered that with the myofunctional therapy. Will she sound? So she says she's got a quite severe tongue tie right to the tip of her tongue. Will she
Yes.
talk and sing differently? Like, will her voice sound different?
So it's difficult for us to say.
Yeah.
And what I always tell patients is, we've got to, it will be for the first week or so that phonation will be affected,
Mm.
because we're just literally telling your body that you can move your tongue a lot more. Now, when I had a couple of opera singers come and see me, because they were told that if they released their tongue tie, because they were tongue tied, they would be able to sing higher notes.
Right.
And that was their motivation for getting the procedure.
Yeah.
And right afterwards, they came to see me. When they come to see me for the review appointment, they were saying, well, actually, it became a lot easier for them to sing, and a lot easier for them to speak, but it took some time to adjust to it.
Right. Yeah. I guess it is just getting used to this whole
Exactly.
massive properly. But yeah, I've heard that. I've definitely heard that. The narrow palate, which obviously sometimes it can expand, just depends on
Yes.
your bones, really, I guess. And what was it she said? There was one question. Oh yes. So that was what I was going to ask you. So with the mouth, obviously the mouth breathing.
Mm-hmm.
Before I knew I had a tongue tie, I was doing mouth taping.
Yeah.
So for 2 weeks, so I put the tape on. 2 weeks, I had like excruciating pain down the back of my neck, but I just kind of pushed through. And after 2 weeks, I didn't get that, but I would get like headaches through the night. Basically, I mouth taped for about 2 years. Then I had the myofunctional therapy, and she said, "No, you probably shouldn't do that. Your jaw just wants to drop; it needs to
Yeah.
release." So I haven't actually mouth taped since. I don't know if you've heard of those xylo melts, like they're like xylitol sweet things that you put in your mouth, and it keeps your mouth like moist all night. So
Oh
I use
yes, yeah.
that.
I've seen the spray version of that.
Yeah,
Yes,
yeah, yeah. So I use that instead. So would you say people with tongue tie is not a good idea to mouth tape?
I agree with you on that. So mouth taping is something, for example, I believe is very good, but in the right
Yeah.
conditions. So if you're mouth taping, you need to make sure firstly you've got no nasal
Mm,
obstructions. Okay,
mm.
you need to do a good nose clearing before. You need to make sure that you've not got any other, like you're not sleeping in an environment where you've got allergens, so you probably need an air purifier as well. And you've got to slowly ease yourself into it. So it's not just like putting the tape on one night and I'm going to sleep that way. No, you've got to train your body. Now, what I use is something a bit more different. So I use the Myo brace, which is kind of similar to, it's like a brace which is geared for myofunctional therapy, and we have for all different ages. I use that when I'm in the gym. I use it when I'm sleeping. And the one advantage I have with that is let's say, for example, I need to, for whatever reason, break the seal. I just open my lips and the air goes in through the brace almost anyway.
Right.
But it also works a lot better in strengthening the muscles of the lip and lifting your tongue up as well.
Okay, yeah, because my son needs that. But then I was seeing, because I got on the Myo Munchie,
Yeah.
which he is, and then so the my brain was like, how is he going to even shut his mouth over the break, like the big rubber thing? Like, does that even?
So we started for different sizes for
Mm,
kids. So the first one is obviously establishing a good nasal breathing protocol. So it's very, very slim. But as we get bigger, the muscles of the lip can be trained.
right.
So we use a bigger device. It becomes a bit harder, but these muscles can be stretched and they can be trained to join over at the end.
Mm-hmm.
So it's done in a very sequential manner. And it's a lot of kids actually like using it because I guess the issues you're having with your son is compliance with therapy. Now, using a my brace is almost like giving him a treadmill. So it
Right.
makes it, as soon as he puts it into his mouth, that tongue is more or less sitting in the right position anyway. It's getting his lips strengthened. However, obviously, he still needs to do the exercises, but it kind of gives him an extra little bit of a push. That's what we're seeing right now.
Right. Right. Is there like a little seat then for the tongue to go on with the Myo brace?
Exactly. So there's a few different types. There's one which you can use for isometric contraction, which a lot of I find children your son's age like. So it's got one part which is kind of like a squeaky. It's got a little kind of like a nozzle out there, which they use your lips to press together.
Yeah.
And inside it has a button where you can press. Use the tip of your tongue to press it, so you're kind of doing a suction hold.
Yeah.
And at the same time, you need to be breathing through your nose. And
Right.
so when you're doing this and you're breathing through your nose, if you're not, you'll see kind of the front muzzle steam up with air, and that shows obviously your mouth breathing.
Right.
So we find this is working quite well for parents who are just having difficulties with compliance. Obviously, it's an aid to myofunctional therapy, but it's still working quite good on getting compliance, and especially because kids can do it when they're watching TV.
Oh, that's good. Good. Yeah.
And the other ones, obviously, like I said, they start off on a small size. We start working, getting their lips together, and as they get, as the muscles of the lips get stronger, we start increasing the size of the device as well.
Okay. Yeah, and also it helps expand the palate as well.
Yeah.
Yeah.
Yes. So like I said, at your son's age, getting the tongue up there is the most natural palatal expander we have.
Right.
So the tongue, a lot of orthodontists are now agreeing with it because it's in the Bible of orthodontics. But the tongue is the best palatal expander we
Right.
have. So the earlier we get it up there, the better the expansion will be.
Yeah. Yeah, that was the thing that got me into mewing. It was like your tongue is like your natural brace. It's a big muscle that just pushes up to help things expand. But obviously
Yes.
it was like I have to really try and push it up, and then I'm building more neck tension. And at night it's
Yeah.
just going, it just needs to drop, everything needs to relax. So yeah, that's what I'm hoping I'll be able to. Do you find that when people have had the release that they can get the tongue up and stay up, does mewing become a lot easier
Yeah.
then?
Definitely. So when we release those restricted fibers, that frees up the motion of the tongue very, very quickly. So, and you'll be surprised with how quick. So, for example, when we perform the release as well, we're in a kind of position called the suction hold. So, which is where your tongue is at the top of your palate, like that almost.
Yeah.
And when we're releasing, all of a sudden, my patient's jaw start opening more and more and more, and they get quite surprised. They're like, I never thought I could open my jaw that much.
Yeah. Yeah, because that's one of the things things when I went to the myofunctional therapy. She measured how much I could open my mouth, and it's not as much as everyone else.
Yeah.
Yeah.
And you'll always see that. Like one sign is everyone says, oh, I've got a small mouth, but I've got the dentist always told me I've got a small mouth. I can't open my mouth enough. And then at that point, you're like, well, what's the reason for the small mouth?
Yeah.
Is it genetics? Very, very. You've got a 2% chance it's genetics. Very, very most commonly, there's usually a tongue restriction, and unfortunately, not all of them are very obvious. So the way to accurately assess you've got a tongue tie is to open your mouth as wide as you can and touch your tongue just behind your front teeth. That's number one. So if you're closing your jaw, already there's a compensation. Now, to really check if you've got a lot of compensations, you have to open your mouth really wide, get your tongue up, but you also have to put your finger just at the floor of your mouth to take that muscle out of the equation. So,
right. Yeah.
And the tongue should more or less be able to get up there. However, in some people, you see it completely drops back down, and that's when they're using, like you said, your neck muscles, the floor of the mouth, to be able to get the tongue up. And it's a very compensated way of moving.
Right. So you were saying that you were like mouth breathing when you were younger and all those things, but you definitely haven't got a tongue tie, have you? Because yours is very straight.
Yeah, so I had a lot of allergies that I think I had very strong hay fever.
Right.
I wasn't ever, so nose clearing wasn't a thing for my mother. She didn't understand. She went to the doctors. They didn't even really entertain the matter. And it was only when I was about 16, 17 years old and I said, you know what, look, I just think something's up with me. We went to see an ear, nose, throat doctor. He did an allergy test, and apparently I'm allergic to most things around. So dust, pollen, grass, trees, and I was just really surprised to hear that. But it made a lot of sense in my head because now I know that, okay, for me to be able to sleep, I really need to do my nasal rinses before bed. I use xylitol spray in my nose as well, helps hydrate it. I also use some essential oils to smell before I go to bed, and then I sleep extremely well. I'm paired with my Maya brace at this point.
Yeah. Oh, wow, that's good. Yeah. Well, at least, yeah. I mean, it'd be interesting if you had to do a tongue tie release on yourself. I don't know if that would be possible, but
I'll be going to Dr. Zagi if it was me.
Yeah, true. So, what does someone say here? She had a chronic mouth breather every night during sleep. Is it ever possible for me to nose breathe during sleep?
Okay. So when I hear firstly slight tongue tie, it's either you're tongue tied or you're not. And the location is anterior posterior. So people are like, oh, slight tongue ties. It's okay. I agree it's not anterior, but it's like being pregnant. You can't be slightly pregnant. Either you've got it or you're not. But it depends on what the condition of your nose is, Chris. So you've got to see if you've got any nasal obstructions. You've got to see if you've got any allergies in the matter. If it's a pure tongue tie issue and we correct it, you should be able to easily breathe through your nose during sleep. But the one thing obviously we have to look at as well is, does the tongue have enough room in the mouth? So like we were discussing, is that palate wide enough to accommodate the tongue, or is it going to be a bit starved is it going to have a bit of problems with room as well? But in most cases, usually people revert to nose breathing, right? Provide everything else is okay after the surgery.
So what percentage do you find are posterior to anterior tongue tie?
It varies a lot to be honest, I've been kind of keeping a note of this and what I see in patients. Now, when I look at it from a genetic point of view, I kind of see people from the African and Asian region have more incidence of anterior tongue ties. And I see more people with a Caucasian or Europe have more posterior tongue ties. But there's always kind of anomalies. So if I was to give you a percentage, I would say probably about 60 to 70% posterior and then 30% anterior. But it's always, it's very variable.
Yeah, but that's the thing, because a lot of people, they just look at that bit, there, and just think that's the tongue tie, but it's the bit, I think for me at the back, it's that bit, the back won't go up, and so it feels like posterior for me.
Exactly. So the posterior ones are usually the ones which are very masked, which if you went to say to someone who's not been trained, I've got a tongue tie, they'll probably unfortunately laugh at you and think that, okay, what's this person doesn't know what they're talking about. However, if you do the floor of the mouth hold, so when I said you put your finger there and you lift the tongue up, then you've 100% got a tongue tie, because that's showing that's then showing you that okay, physically your tongue cannot elevate without assistance.
Yeah, it's funny, you know, like, and that's the thing, before you come for a release, you need to be able to suck your tongue up, like,
Yeah. Oh
yeah.
wow, you're doing very well.
Yeah, I can do my, I think because of the mewing, I built up a bit of,
Yeah.
but I can very wide.
Oh, you're doing well. You're better than a lot of people.
I was going to say, when I show people and tell people, no one can do that because their tongues are just not strong enough, I think. Yeah.
Yeah,
Even if they have a tongue tie, they just don't know how to master their tongue.
I I agree with you, and it's like because mouth breathing has become so socially acceptable, and right now, like I said, we come back to diet all the time. We're not chewing the right foods we need to. We're not we're eating very processed soft food. So obviously, our tongue is not having that bit of stimulation and the exercise it needs.
Mm,
So that's
yeah.
why a lot of people do have tongue tie issues that they're just tongue tone issues, sorry, that they're just not aware of.
Yeah. Yeah, and I think with children, like my son can't really do that yet. I mean, you know, getting them to, that's part of the myofunctional therapy, is to click
Yeah,
it. And then once you like, then just try and hold it up after that click. So he's getting his head around that a little bit more, but that's part of, you know, the tongue needs to be strong enough to hold it up so then you can release it. Is that right?
yes, exactly. So we want to kind of get more or less the suction hold in place because then once we release it and we get all the mobility back, the body just kind of sits into that position. Whereas to learn it from scratch, if we do it, let's say before, let's say if we were to release without doing myo and then do a suction hold afterwards, it becomes very overwhelming for the body. And then that's when we see, okay, people kind of lose motivation very quickly, and then the tongue drops back down anyway and gets even tighter. And that's where it becomes very difficult for us to work with afterwards.
Yeah, makes sense. Well, someone put here, can a baby breastfeed normally but still be tongue tied?
Yes. So when we look at obviously tongue ties and babies, there's a lot of other different factors that we have to put in. So number one is obviously the mother supply. If you're blessed with a very bountiful supply and your child's not having to work too hard, yes, that will also mask the symptoms of a tongue tie. Now, a lot of times as well, the other symptoms is pain when breastfeeding. Now, pain is very relative from person to person. Usually, a second-time mother, if she's had a baby that was tongue-tied, may not notice it as much because they may not have difficulty. They may not have any pain when breastfeeding.
Yeah.
And the other thing you'll always see is there'll always be either difficulty gaining weight or getting too much weight, because another sign we will see is falling asleep during feeds. So falling asleep during feeds for a baby is never healthy because this shows us that they're using more energy to get the food than they're getting from it. So it's like eating celery all the time almost. So babies need to gain weight, and at that point, that's one of the key tongue tie signs I'll always see.
Right. So when they fall asleep, that's one of the signs? Or
So falling asleep during a feed, yes.
yeah, sorry, during a feed. Right. That's interesting because that's what most people do, isn't it? Just try and get their kid to go to sleep.
Yeah, well, at the end of the feed, it's fine. That's to be accepted because feeding is still a very active process. But then during, and then it's kind of like having a little cat nap during the feed. So like, okay, I'm feeding, falling asleep, and then I'm coming back on. That's one of the red flags for me.
So what does that mean again? That means that they're what they're doing? Why are they falling?
So they're using too much energy. So usually it's because instead of using one muscle like the tongue, they're using the jaw, they're using the back of the neck, they're using a lot of other force. So you see that in babies when they suck, they're like kind of,
Right, yeah.
they're using the jaw, and the jaw is a huge collection of muscles which are not meant for feeding. So that's why they will start to fall asleep, because of just the negative energy output at that point is too much for them.
Wow, that's so interesting. Yeah. I can't remember if he used to do that, but what else did someone put here? So my son was breastfed for 3 months having a tongue tie. He gained weight, but the main problem was that I had to help him latch often and I could only breastfeed him in one position. I had pain periodically because he was sleeping fast. We had lazy. Right, there you go. is that the same woman? Yay!
Yeah. Hi. Yeah. How's Archie doing? Hopefully he's doing really well. But Roxanne did touch on another topic that I always get a lot of questions about is why laser versus scissors.
Yeah.
Now,
Well, because it looks brutal, absolutely brutal, the scissors.
exactly. And unfortunately, a lot of lactation consultants and midwives do releases with scissors, which I don't have anything against, and I'm really clear about that. But I said, if you're going to be doing a scissor release, you need to do it properly. So you need to use magnification to be able to see the tongue properly. You need to lift up the tongue in such a position, take away the tissues, and then cut. But also make your patients aware that they will have probably more pain because of the bleeding's not being controlled, so the inflammatory response is being stimulated more. There's more discomfort because also the body's having to clot, and then also you have more risk of damaging something you shouldn't. So when we compare this to a laser, and a laser uses, in this we use a CO2 laser, so it's a cold laser, very gentle on the tissues. It coagulates the site, gives me clear surgical visibility, and with a baby, it stops me from cutting too deeply. Now, unfortunately, I do see a lot of scissor releases gone wrong as well because they're so sensitive with the scissors, and scissors cut through anything. You put like any organ in front of it, it'll cut through, not thinking twice. The laser is very selective and very so we've got a very small size of tissue that we ablate. Now, even if your child was to move a bit, it's not an issue. I take my foot off the pedal, and the laser stops almost instantly. Whereas with scissors, if you're snipping and you've got the sharp instrument in your baby's mouth, they start to move around because they're not restrained or whatever. You can cut something you don't want to.
It's horrible.
And it's unfortunately in the US, I don't think babies have any scissor tongue tie releases anymore. They're very, very few between. But in the UK, this is something obviously I do say that they should be carried out in the correct environment. And I do get a lot of people going to people's houses, performing releases. And for me, I wouldn't want my child to go through that.
No, well, that's the thing. America do seem like way ahead of us, but luckily enough for us, you're getting trained in America and bringing it all here. So it's like, yeah, it's perfect.
Yes. No, thank you.
Yeah, I'm glad that I stumbled across you. I'm really pleased that we've got access to someone that's been really well trained. But yeah, so the laser is the only thing. I mean, I did watch some videos of tongue tie releases, and it looked horrible with the scissors.
Yeah.
Horrible.
Like I said, that put me off from doing it the first time because I still remember when I was doing my mentor was with me at the time, and he said, "Okay, we can do a tongue tie release." I was like, "All right, cool. This sounds very interesting." But with the amount of blood you see with scissors, and this was an adult as well. Let's put it this way: it was. I thought at some point, I'm not queasy, but I was worried that my patient was going to be going into getting a blood transfusion because I was using that much. But it's why I said I would. And the floor of the mouth is so the tongue area is so full of blood vessels, nerves, arteries, you name it. It's one of the most sensitive areas of the body, and something can go wrong very, very quickly.
Yeah.
So you want a tool that you can use, which is going to be safe, predictable, and reliable each time. Whereas, okay, with scissors, for example, if you've got a blunt pair, or if it's been used a couple of times, it's not going to be very safe to use. Whereas with a laser, we know it doesn't fire unless it's safe to.
Yeah, well, I know that be under the tongue with all those blood, the veins and stuff, because with nutrition, any supplements, I always say like swish it around your mouth, get it under your tongue, because it gets into your bloodstream much quicker. So I always look at that area and think, God, I don't know. like you say, I think laser just seems like way, way safer.
And to be honest, if it wasn't, we would all be using scissors. Now, there wouldn't be a reason for us to use lasers. Like I tell a lot of people, it's not because we do have a laser, that's why I'm saying scissors are bad. I'm saying because as in my training where I'm used to working in the mouth, doing implants, working with bone, working with gums, scissors do not play a purpose in the floor of the mouth at all.
No, yeah, I feel that. 2 seconds, so I don't think there's any questions, but I might just recap. So, will baby cry? Yeah, I mean, so you don't put them under when they're a baby,
No.
but you do when they're like at what age?
We have different options. Now, usually if with a lot of behavioral management, most children tolerate a tongue tie really well. So
Tongue-
tongue tie release really well. Yeah. Um, Now, if they're extremely nervous or we have some behavioral issues, we have, first of all, nitrous oxide, which is laughing gas. We give it to them in a very controlled manner, titrate it with oxygen. The child gets very relaxed, starts getting a bit more compliant. They kind of, and it has a bit of very good analgesic effect as well, so they don't feel the needle when we're numbing them. Now, if this is not possible because they're just very stubborn or the behavior is not there for them to be able to breathe through their nose, we do have intravenous sedation as well. So intravenous sedation is where I get a colleague of mine to come in, and we do this on adults, kids, anyone over 20 kilos. He gives them some medication, and it's not as if they're completely asleep, but their mind is quite out of it. They get very compliant. They just kind of want to lie there and still, and they're very, very relaxed.
Mm-hmm.
And then surgical time for me is almost about 10 minutes because they're very exactly still. They're where I need to be. And also, I'm not worried about them moving around or jumping out the chair sometimes.
Mm-hmm. So, but generally, do you just do a numbing agent under the tongue? Is that what, say, like if I, when I come in, what will happen with me?
So you will have firstly some cream to numb up the tissues first, and then I'll give you a bit of a local anesthesia. So just a little injection, very, very small amounts, just so you don't feel any discomfort. And then we do the procedure, pop the stitches in. During the procedure, it's pain-free. Mm-hmm. So obviously the most uncomfortable part is just that little bit of numbing, but I have a very strong numbing cream, and a lot of people don't even feel the injection now.
Okay, that's good. And my son will have the same procedure. Will it be the same?
Yes. So obviously with children, it depends on their compliance. To be honest, I do prefer with obviously at 7 years old, they're quite they're very easy to reason with. They're very, you can kind of work around and offer them a good reward for behaving. But sometimes it always does help to give them the gas, because then it just takes away their slight apprehension when they do feel something. And I've also found that little bit of analgesia that you get from the gas is so effective, because even with some nervous people who don't like having their blood taken, having injections, that bit of gas, just you don't feel it at all.
That's good to know. I had another question then. I can. So, at what age do they? So, babies, you do it obviously. Babies is ideal to get them when they're babies.
Yes.
Then at like toddler age till well, I suppose from toddlers onwards, but you can't get young kids to do myofunctional therapy. That's the trouble, can you?
No. So there are different, like some therapists do find to do some exercises with kids. However, I find that like there's a bit of a gray area, which is from about 1.5 to 3.5. So I still see patients this age. We do manage to perform releases. However, it's usually very similar to a baby's procedure. So where the parents are actively going in and managing the wound and stretching it. And this is because obviously they're unable to move their tongue very, very freely. Unable to comprehend the fact they need to move their tongue and do exercises. So my functional therapy usually is started from about 3.5 upwards, when you can actually reason with a child and they can follow instructions. But there are small little exercises we're finding you can do with the younger children as well. And it just helps make the procedure very predictable.
Okay. And then would you say there's always benefits for children to have the release? Like there's never a reason not to?
Yeah, so if we're seeing symptoms, like we're saying, well, a lot of times it's the sleep symptoms, and we get those children who parents can't manage because it's like, my child is always so hyperactive, there will definitely be a benefit for doing a release. Because at that point, we're going to get them sleeping better. We're going to get their physiology changing very quickly. Now, the question we do have arise sometimes is, I have some patients with anterior ties, like to the tip, and their parents have not noticed anything. But then I say to them, obviously, we've got to look at it from a functional point of view as well. Right now, your child is still at the point where he's got a narrow palate, although you may not have noticed he's got any sleep issues. If we were to perform a sleep study on him or do some further exams, we could notice he could be at high risk for sleep apnea. Now, would you want to act preemptively, or would you want to act retrospectively? Would you want to act once everything's all settled in? But I always say, bear in mind that the longer you leave it, the more these changes stick onto the organism, the more it's difficult for us to, once growth is finished, to achieve the ideal facial growth as well and make sure the palate's there. So it's always a discussion with parents on what they feel is best. But I always believe giving everyone the information, making sure they're aware of all the benefits, all the, let's say, side effects, possible things that can go wrong, and making an informed decision together what's best for the patient.
Yeah, sure. And then just for adults as well, is there any like repercussions for adults that are, you know, I guess not doing the exercises and would be...
Yes. So with adults, obviously, if you're not going to do the therapy pre and post, I won't release anyone who hasn't done pre-op therapy. Now, I tell a lot of patients, and I'm very strict about it, I say, if you don't do your exercises after the procedure, it's not going to benefit you. You've kind of just thrown away all that time you put through and all the effort you put in. So it's very, very rare that we do see, for example, let's say scarring form on adults if they do the exercises really well. There are still ways that we can go in, let's say after the first couple of weeks, if it's they're having any difficulty or something, with the wound is still malleable, so we can still massage it, kind of stretch it out manually, and then it gets back on the right track anyway.
Okay.
Other things that can go wrong, obviously, with the laser, it's extremely safe. You're very unlikely to cut any nerves. You're very unlikely to cut any blood vessels because you have such a good range of visibility, and it's a very, very safe procedure.
Okay, that's good. Yeah, I think one girl I saw on YouTube just said that she didn't, again, do the exercises and her tongue kept thrusting forward every time she... And that she didn't realize that would happen, that, you know, her tongue just became this like big wild animal.
Yeah. It does happen a lot. Like, so if the tongue, like I said, if the muscle's not trained, it's not going to know what to do. It's just going to literally go wherever it feels comfortable. And so then you might develop a tongue thrust afterwards, or you might feel that like, okay, my tongue is just sitting, it's too big for my mouth as well. That's another side effect that we may have if tongue space is not addressed as well.
Right. So what do you do with that? You widen the palate?
So yeah, to treat tongue space, the best way is to widen the palate. If, for example, surgery is not an option, you can even use the Maya brace as well, and that helps quite well because it just holds the tongue. Or the tongue space issues will more happen when sleeping. So the Maya brace then kind of camouflages the tongue space issues as well.
And then potentially could widen it naturally, depending on...
Yes. You might get some widening of the palate. Now, like you said with mewing, I also work with a myofunctional and speech therapist, and she said she managed to get 6 millimeters on her palate by doing a lot of the suction holds, by doing a bit of modifying some mewing techniques as well. There are people who do manage it, and obviously there's people who, on the other end, who don't. But I would always say the Maya brace works quite well because although it's like forcing the tongue up, it just helps kind of the mouth to adapt if you've got a tongue space issue.
Yeah, who was that? Was that Carrie then at Facial Work?
That was Katrina Rogers. So Carrie also is one of Dr. She's trained with Dr. Zaghi as well a few times, and she's your therapist, I think. Is that correct?
Yeah, my therapist. And every time I'm like, oh, sorry, we've not been doing yeah, it's all right though. We're going to get there. We've got our kit and we're getting through the exercises, but very slowly. Okay, well, I don't know if there's any more questions. Let me just have another look. Oh, right. So, yeah, your clinic, you're in London, aren't you?
So, yes, I'm in Chelsea, London. And so how many in person? So usually like we're doing with yourself is we can do a consultation virtually or and then we start the myofunctional therapy, which is even virtually. Then it's usually one visit to me to have the procedure. And then afterwards a review, which can also be done virtually if obviously needed. But for children, usually it's a bit different. So they have an in-person consultation. If they're a baby, they can have the release on the same day, obviously, if possible. And then they have a 1-week review in person, which is mandatory.
Yeah. And I guess, the costs are different for...
Yeah, so the costs are on our website. So if you look at Happy Kids or American Smile, you'll find all the costs for all the treatments there.
Yeah. Let me just scroll through and make sure that there's not any... very good, especially in very kind person as well. The patient. Oh, that's nice. It's obviously one of your patients. You've done so much progress. Yeah, this is some of your patients here.
Well,
This is nice.
thank you.
So the wait list, well, there's not, I guess you just have to put the myofunctional therapy in first, don't you? So you need a good 3 months before you book in anyway, don't you?
Yes, so myofunctional therapy, anywhere from about 8 to 12 weeks usually is more than sufficient. So, and wait lists, we're quite flexible with getting people in once they're ready for the release because I don't want to keep you waiting any longer. So, the staff at the practice are very quick, and if you call them up saying I've done my myofunctional therapy, you should get an appointment within a week or so.
Yeah. Okay, cool. Let me just make sure that I'm saying, not practice video, talked about that. Yeah, I think we covered quite a lot, didn't we?
Yeah, no, it was a really, hopefully it was really informative. I'm really grateful for you to have me, for having me here, Haley,
Yeah.
and it was so nice to speak about everything tongue tie. I think there's one question which says, if I find people's face shape changes afterwards, hmm, varies on the age.
Mm.
Now, we do generally see some positive improvements in adults, so that can be also, let's say, if you've got a very square face, not because of that's how your jaws are developed, but if your muscles are very enlarged, you might get a bit more of a slender face afterwards. With children, we do see quite a lot of benefits once they do the myofunctional therapy, and we do that also in the correct way as well. That we will change their faces shape, get them more symmetric, get them more get them more symmetric, and get them nice and wide as well.
Yeah, yeah, I've seen that happen. I've seen loads of before and after. So I just want to make sure that this is going to save because I want to post it to. I've not done this before, so I guess I just pressed the X. Then yeah, you have any idea now what I do to save this and post it to my?
I think if there's a little next to the X, there's something you push there, and that could be where you can save it.
Okay,
Or,
let me just make sure I save this. Okay, I don't know where that is, but hopefully, hopefully it's going to
okay.
save what will be lost. Yeah, thanks so much again for all your knowledge and all the work you're doing. And
Thank you again.
look forward to seeing you for my release, which I'll share as well at the time. Right, okay, I'll press off. Okay,
Thanks again, Haley. And honestly, it's such a pleasure to be with you on the Sunday. Always, you can record your release if you want to do it live. We'll do it live as well. But can't wait to see you in the practice. All right. And thanks everyone for attending.
thank you so much. I'll speak to you
Thank you
soon.
soon. Bye.
Bye bye.